Hello everyone, good afternoon. My name is Janan Jensen and I'm the Executive Director of the Health and Environment Alliance, also known as HEAL. I would like to welcome and thank you very much for joining us for this webinar on what health professionals can do to help mitigate climate change. This is the second webinar in our series called COP21 Perspectives for Health on the Road to Paris, and follows a webinar in June on the Lancet Commission on Health and Climate. The recording of the first webinar is available on our website if you've missed it, so don't hesitate to download it. Now over to our two presenters. We are very happy and delighted to welcome with us Bettina Menne, Program Manager, Climate Change, Green Health Services, and Sustainable Development at the World Health Organization's European Office, as well as Louise Newport, who's the Scientific Policy Manager at the UK Department of Health. Thank you very much both for joining us. That climate change will be a challenge to our health system is a well-known issue. But we do not have to stand by and wait the events. There are numerous examples of what can be done by health professionals and services to tackle climate change. The European region has been at the forefront in developing solutions and best practices, and many of these activities have been coordinated through the WHO's Working Group on Health and Climate Change, also known as HIC. Bettina, you are one of the driving figures of this working group. Would you like to start by explaining to us what it's all about and give us some examples of good practices?
Thanks very much, Janan. I hope that everybody can hear me, and I would like to say good morning or good afternoon or good evening, depending on who is connected. Janan asked me to mainly work on the mitigation aspects for the health sector, and mitigation she intended to speak about the co-benefits in particular of greenhouse gas reductions and what the health sector can do. But prior to illustrating a few examples from our European network, I would like to introduce you a little bit on where this all comes from. Next slide, please. Many of you have listened to the IPCC or to the recent Lancet Commission. I'm not sure you know actually how the European region is affected. We do have 53 member states with around 860 million people with very high levels of inequality and high levels of different climate exposures. You might know that 70,000 people died in excess in the 2003 heat wave in 12 European countries. And on average, we are estimated around 27,000 more deaths per year starting in 2030. The World Bank estimated that the health costs, the overall costs, could be between 2 to 4% of the GDP in 2050. We also have observed in the recent decades, through climate change, globalization, travel and trade, an increased risk of infectious disease outbreaks. Some of the examples were the recent dengue outbreak or chikungunya in the past, or West Nile virus, which is currently ongoing. But also the health of workers will be affected, and the global estimations are that there could be, by the end of the century, a 20% of loss of productivity. Malnutrition, even though you might not think this could be a problem in the European region, but in particular our Eastern European countries, we estimated around 3.7 million children could be affected because of nutrition problems. All of us, we know that deep cuts in greenhouse gas emissions are required to limit the warming to a 2-degree relative to pre-industrial levels. And this requires substantial technological, economic, institutional and behavioral changes. Air pollution, through reducing air pollution, this is one of the avenues we are lobbying for. Air pollution in Europe costs at the moment 1.3 trillion euro and around 600,000 deaths per year. The health co-benefits through reducing air pollution could be significant, and estimates in the IPCC highlighted that they can largely reduce, the health benefits can largely reduce the mitigation costs. But also if we are not able to limit our warming to a 2-degree, the costs on health adaptation will be increasing. And there are estimates between 1 and 4 billion euro by 2050. I don't know whether you know that healthcare in 49 European member states produces 4.2% of all greenhouse gas emissions. And there are a wide range of issues we all can do to lobby for a preventive approach, which is also cost effective. This includes, and I will illustrate some examples, promoting walking and cycling, green spaces, safer transport and housing interventions, renewable energy, just to mention a few. Now, next slide, please. This all started in 1989, actually, with our first big European conference of ministers of environment and health, and was further taken up in 1999 through a study on the early human health effects of climate change and stratospheric ozone depletion. Because of the heat wave event in 2003 and the big flooding in 2002, member states asked to work further on extreme events prevention and to work on renewable energy and what this could be meaning for the European countries. All that then led to the Parma Commitment to Act and the Regional Framework for Action, which is a tool to facilitate the implementation of the Commitment to Act. Next, please. Hello, next slide, yes. The Parma Declaration, actually, the member states agreed, so the 53 member states, ministers of health and ministers for environment in collaboration, agreed to integrate health issues in climate change mitigation and adaptation measures, to strengthen health systems, to develop early warning, to further lobby and provide public awareness programs, as well as to collaborate to increase the health sector's contribution to reducing greenhouse gas emissions and stimulate action in other sectors to do the same, as well as to encourage research and development. Next, please. We, as a follow-up of the Parma Commitment to Act, as Janon was earlier saying, we did set up a working group. This working group is composed by 8 agencies, international agencies, European Union Commission included, as well as 38 member states. In 2013-14, we assessed the level of implementation of the Parma Commitment. And I just show you one slide on adaptation, so which means, with other words, the reduction of harm. 24 of our countries have developed national adaptation strategies or action plans which do include health. You can see it on the left side because the light green are those countries which have developed a national only a health impact assessment. The dark green are those countries who developed an impact assessment plus a national adaptation strategy. And the light blue are those who did develop only a national adaptation plan. Having said this one, now what is the content of those plans? And in practice, member states are mainly continuing what they are currently doing with a slight emphasis on more public health action. And if you look at the right side, the top runner is actually increasing disease surveillance, followed by developing better environment and health services, increasing health security, strengthening primary health care, and building climate resilient infrastructure. Now, this is just the issue, just one slide on adaptation. If you want to know more, please be in contact with us. What I will now be focusing on is what did we do and what are the examples from European member states at the local or at the national level on action taken to promote the reduction of greenhouse gas emissions in their own services. Next, please. I classified or grouped those interventions based on some key requirements or drivers or motivators. First of all, a few of our countries have regulations in place which also oblige the health sector to take action or have set up governance mechanisms to include health either in adaptation or in the mitigation processes. An added value is also shown in those interventions which actually promote or contribute to service delivery or increase resource generation or do meet the unmet needs or include some education with certification and promote local assets which do have benefits for the environment as well as for health, and promote the benefits for patients. The figure is just coming out of a publication of our health systems persons who assessed the cost effectiveness of public health interventions, and actually came out with the key message of every $1 invested gives us an output of $4 because of the costs averted. Next, please. Next slide, please. Yeah. So let me show you a few examples, and Louise will be definitively building on some more. First of all, in those areas or in those countries where we have a strong governance structure in place, such as through a cross-sectoral government committee, which has the task to set a priority for health, as well as is not only including working towards climate change, but is also including the climate change and health dimension into other health programming, such as, for example, which is now ongoing in Macedonia, the integration of health and environment and climate change into health and environmental planning, or into overall health programming. Another example is in those countries, and the United Kingdom is one of them, where you have a Climate Act, which obliges all government departments to reduce greenhouse gas emissions. And as a follow-up, a number of initiatives have been developed, and one of them is interesting, which is the development of a specialized so-called Sustainable Development Unit. This Sustainable Development Unit, which is across the NHS, the National Health System, does, for example, produce health checks, which does include, for example, how much do you plan to reduce your greenhouse gas emissions, which measures are you taking, are evaluating on an annual, on a monthly basis, the impact it does have for patients, for health, for the economics, for the environment, and further developed through this one engagement strategies for all departments, for all providers of health. Next, please. And another example is provided in those areas where climate change action does contribute to service delivery. An interesting example is here in the Republic of Kyrgyzstan, where I am in this moment. Through the National Action Plan, they promoted the so-called Village Health Committee project. These are 1,400 village health committees in the country, which is covering 70% of the country's population. And they have developed actions for health on climate change, which does include how do people need to behave in a case of an event or prior to an event, as well as actions they themselves can take to mitigate, to reduce their own emissions. Even in a country with high level of still unemployment and difficulties in reaching the health system's goals. Another example is, which is probably more familiar to many of our health system developers, is the use of telehealth or telematic networks. And an interesting case comes from Italy, where the enlargement of a health telematic network for cardiovascular patients provided a 35% of reduction in hospital admissions, 12% of fewer outpatient visits, a reduction of 15 days in waiting times, and as well reduced travel time and out-of-pocket costs for patients and their families. Next, please. Another example is where a system could be actually using the revenues for financing its own system. Now, an example from Germany, they estimated that German hospitals could save 600 million euro and 6 million tons of CO2 without a reduction in services, so continuing as business as usual. Therefore, they created so-called energy-saving hospitals and provided awards to those who actually reach the energy standards. And so far, 43 hospitals have been certified, and they have developed a tool which is called Climate Manager for Hospitals. The basics of it is a return on investment, cost saving, and reducing the pressure on the system. Next, please. Another example is provided by addressing the unmet needs. This is in particular more important when you think about universal health coverage, which is one of our organizational goals. And an example is energy. in some of our areas, we don't have enough energy for healthcare, or we don't have water to run our services. So the example of Kyrgyzstan is to use renewable energy, in particular in remote areas. And the assessment we carried out is that it provides benefits for vaccines, refrigeration. It provides basic treatment and life-saving treatment. It is 24 hours functioning, in particular the emergency services. It provides hot water for hygiene and sanitation. Similar, when we provide water to the Tajikistan different hospitals, we see not only a benefit for health and, of course, a potential reduction in some of the diseases, hygiene-related diseases, but what we also found is a huge engagement of the community, because they liked it to see that they actually do have water, clean water available in their hospitals, and in some instances, through small-scale water safety plans, they were also provided to the whole of the community. Next, please. Another example is the activation of the local community. And an example is here the National Action Program for Mobility Management, which does in Austria. And the original was actually to reduce CO2 emissions for promoting environmentally friendly and energy efficient mobility and practice more cycling and walking. It produced green jobs. It had benefits for cycling and walking and the reduction of health effects, particularly related to obesity, which is currently under evaluation of using the WHO tool Health Benefits Calculated, the WHO Health Economic Assessment Tool, which is also called the HEAT. And more than 2,900 project partners are reducing around 530,000 tons of CO2 per year within their projects. This type of initiative has led to an activation of many local initiatives, and it does not need to be developed at the national level. Very often it's our cities who actually are starting to promote and to develop such initiatives at their level. Next, please. So, to make it short, because we have 10 minutes of time available, my experience has shown that all of us, we are to some extent champions. And all we can is explain the ways in which climate change affects our health and the health of the people around us. We all in our little, at the local level, at the regional level, at the national level, and in some cases at the international level, we can take action to reduce climate change with benefits for human health and the environment, and I just illustrated a few of the examples. But we also can take action to improve human health and our systems while ensuring benefits for our climate, the environment, and in particular equity. We also can catalyze action on the many solutions available and press for action in implementing them. Next, please. The WHO did develop many tools, and you find our website here down here. And not only we at the regional level, but headquarters. And we are just on our way globally to launch global campaign for Paris to strengthen the health in the Paris Agreement, and more than everything, that the Paris Agreement is a robust agreement. And we developed many tools. You can download them from the website. It mainly health impact assessment, tools to estimate the economic costs, both of transport, for example, but also of adaptation action, heat health action plans, flood prevention, and headquarters did provide interesting information, a review of the evidence on the co-benefits for human health in reducing greenhouse gas emissions through different interventions in energy, as forthcoming in agriculture, in the healthcare itself, and promoted those initiatives also through the Sustainable Development Goals, which are hopefully to be approved at the meeting at the end of September. Thanks very much, and I hope if you have questions, send us an email, contact HEAL, or come back to us.
Thank you very much, Bettina, for this excellent overview and the many concrete examples that you provided from country experience, as well as the vast array of tools and evidence that's available from WHO.
We are now joined by Louise Newport, Scientific Policy Manager at the UK Department for Health. Thank you very much for joining us. and I'm handing over the floor directly to you. The floor is yours.
Great, thank you. Yes, I'm Louise Newport. I work on climate change, extreme weather and sustainable development policy at UK Department of Health. And I've been asked to share our experience of bringing climate change into the health agenda. And as you say, the role of health sector in mitigating climate change. So next slide. So from the IPCC's latest assessment report published last year, we can see that climate change is already happening. Increasing temperatures recorded in land, sea and air, sea levels rising, Arctic sea ice melting, and snow cover diminishing. And this has dramatically occurred following the industrial burning of fossil fuels and the production of temperature-retaining greenhouse gases. So the science is clear. We know that climate change is happening, and this is mainly due to man-made emissions. And for the UK, this will mean hotter, drier summers and warmer, wetter winters, changing patterns of disease and an exacerbation of our current health problems. With the Lancet Commission on Health and Climate Change recently reporting that the past 50 years of health improvements could be wiped out. So there's much to do to raise awareness of the health impacts of climate change, and I applaud HEAL in setting up this webinar series to help raise this awareness. Next slide, please. So this slide from the Met Office is very useful, I think, in showing the modelling that's being done. For example, the blue simulation at the bottom is the temperatures across Europe, but without man-made greenhouse gases. The red simulation is with those greenhouse gases. And if you see the black line following the red simulation, so showing that temperature increase is happening due to the man-made emissions. The dotted line across shows 2003. That's the temperature that occurred at the pan-European heat wave. And the inset shows those temperatures across Europe, particularly across France, where across Europe we see that 70,000 deaths occurred, extra deaths that summer. And also for the UK, that was an extra 2,000 deaths. And these temperatures, if you track along that dotted line, are going to be a normal summer by 2040 and a very cool summer by the 2060s. 13 of the 14 hottest years we know are in the 21st century. And last year was the hottest year on record, and this year has already exceeded those temperatures. Globally, that is. So next slide, please. So climate change is a public health problem. These are the impacts that we've seen and going to see across the UK. So as I mentioned, an increase in the heat-related illness, skin cancer and death from respiratory and cardiovascular disease, with those key temperatures being normal by 2040. Increase in flood-related illness, and from the UK 2007 summer floods, we know that there's a 2 to 5 times increase in mental health symptoms seen in flood victims. And the Public Health England have a cohort at the moment to look at more detail about the health impacts. The increase in food, water and vector-borne diseases. We know that the climate-sensitive diseases, vectors, are moving northwards. And for example, dengue and malaria have now migrated into southern Europe, and there are UK vectors now being seen. So it's not long really till we see these diseases in the UK. And then the health impacts from the air quality and aeroallergens, as we have invasive plant species coming across, moving further north due to these climate changes, and an increase in different pollens that people are not used to, and increase in respiratory problems as a result. And also the pressure on healthcare providers to keep the services running. We know that with the increasing temperatures that we need to desperately make sure that hospitals are resilient to these impacts, and guidance is produced, but in a recent report, it's shown that 90% of our hospital wards are at risk of overheating. So a lot needs to be done. And mentioned about the Lancet Commission on Climate Change and Health, that the last half century of health gains will be undermined if we don't act now. So next slide, please. There are huge health benefits to be gained from a low carbon lifestyle. So much can be done to reduce climate change, reduce the impacts that we're going to see, and it's a win-win situation. We get benefits to health. So reducing cancer, heart disease, obesity, for example. If we're targeting reduced urban air pollution, increased active transport, reduce red meat consumption because of the greenhouse gases that are produced from the agricultural industry, and increase green spaces. That not only helps protect against the increased heat as the green spaces cool urban areas, but also have benefits to health from mental health impacts, mental health benefits of green and open spaces. And the Lancet Commission highlighted the potential benefits for health of tackling climate change, with £17 billion costs averted by 2030 through increased active travel. So lower carbon does save lives and it saves money as well. So next slide. We've been doing a lot internationally, helping to bring forward the resolution on climate change and health in 2008, and most recently with the air pollution resolution at the World Health Assembly this year. There's work that's being done across the European region, so that's the 53 member states, for the Palmer Declaration, and there's a regional framework for action. And of course, we're all working towards the COP in Paris later this year, November 30th to 11th of December, where health is more and more having an important voice. But we know that the Paris event work will not stop. Things will continue into next year. It doesn't have to all be centered on Paris and nothing else. There are lots of work happening beyond and into the next year. Nationally, we've got our Climate Change Act to reduce emissions 80% by 2050, and also looking at adaptation for the sector. Every 5 years we have a risk assessment, and that's followed by a national adaptation programme. We've measured the carbon footprint of the NHS and public health and social care, and these produce 40% of our public sector's total carbon emissions, and 72% of that carbon footprint is linked to procurement. So that's a key area, looking at supply chains, etc., and making sure that we're being more sustainable. We've had some energy efficiency sustainability funds. The most recent one, 49 million, is projected to have savings of 118 million within 10 years. So huge cost savings when you look at the energy efficiency that can be achieved in the NHS. And pockets of good practice that to be shared out and extended across the whole health system. For example, Bart's their TLC project of turning off non-essential equipment, turning lights out, and also closing doors at night reduces the noise pollution, helps patients sleep better, and they recover better. So not only the cost savings, 105,000 saved on the few wards that were piloted, the benefits to health and benefits of quality to patient care. And that's extrapolated as potential savings of 35 million across the NHS. So lots to be done. And there's a sustainable development strategy. You can see the website link there. And there's going to be an event next January where we look to see where we are on strategy. And of course, this Parliament, we have the previous government, the joint government said that they wanted to be the greenest government ever for the UK, and there have since been green government commitments. looking at printing, waste, energy use and domestic travel. Okay, yep, next slide please. So the voice of the health sector has been raised more and more. WHO have done a lot of work, and they have a joint work with UNFCCC to produce some country profiles. I think as many as they can by Paris, but this will be an ongoing project to look at how health is being impacted from climate change. And at the Lima COP, there was a specific request for health to be more embedded in the text. So we know that much can be done. We know that across the European region for WHO, for example, solar power has been put onto hospitals that's really made a massive difference to their health sector, being able to work outside daylight hours, so safe care with renewable energy. Electric vehicles being introduced more and more, and sustainable sources. They're helping to reduce air pollution. And if we keep working towards active travel, we'll have healthier people and a healthier planet as a result. So it can be done. We just need to raise the awareness more and more. So next slide. So in the run-up to Paris, it's a great opportunity for the health sector. We hold a unique position of trust. So we can raise the profile of climate change through making the link to health. We can dispel the myths around climate change and also confirm the reality that it is already happening now. So think about who you can tell as a health professional, how you can make a difference, how you can share the examples with patients, with stakeholders, and really bring your voice to this. So there are benefits to health and cost savings to be won. So many times we don't measure the cost benefits and make those links to health. So if you are in a position to do this, please do in any projects. Make sure that you include the cost savings and how you can work sustainably. And it's okay to work sustainably. You know, this has gone beyond the tree hugging stage. It's now business sense. Many businesses are looking at being more sustainable. So seek to mainstream climate resilience and sustainability into all policies and practices for future healthy, resilient, sustainable communities. We're all trying to do our bit in wherever we are, and more it's a louder health voice in the climate change arena. Thank you. Next slide, please. So finally, just a thanks again to HEAL and Bettina at the WHO for their work on bringing health to the climate change discussions. And also thank you for listening. Lowering carbon really does save lives and saves money too. Thank you very much.
Thank you very much, Louise, for that very informative and very interesting presentation.
I would like to just again put out the opportunity for people to send us information about the activities that you may be doing in your country or your particular area of health to help save the planet, because this is definitely case studies that policymakers want and need to hear this information at all levels. We as HEAL and many other health groups will be going in strong force to Paris at the COP21 meeting in December, and very much working towards a fair and binding agreement. We will also be having a delegation. There will be a series of health events taking place, ranging from healthy hospitals to healthy energy and health professionals, as well as the Health Summit, the Global Health Summit, which is run by the Global Climate and Health Alliance and WHO, and which will be held on December 5th. So we will be putting up information on our website through Twitter and in the run-up so that people can find out more and join either by being part of what's happening at Paris, but also from wherever you are, sharing with us through Twitter, through Facebook and other ways. So thank you everybody for this call. I would like to close it now and look forward to having any further questions or comments. Please send them to Katerina. Thank you very much.